Welcome to NSG 227, Study Session 8, Wound Dressing. Introduction. The integumentary system, that is skin, is the body's natural barrier against invasion of infectious microorganisms and a break in the continuation of the skin, that is wound, predisposes to infection. This teaching session teaches about how to dress a wound, why a wound should be dressed, assessment of wound, the technique of wound dressing, the factors that delay wound healing, the stages of wound healing, and the complications of wound. Learning outcomes. When you have studied this session, you should be able to 1. Define wound dressing. 2. State the purpose for dressing wound. 3. Assess and make nursing diagnosis for the procedure. 4. Discuss nursing plan for this procedure. 5. State the technique of the procedure. 6. State the factors that delay wound healing. 7. Identify the stages of wound healing. 8. State the complications of wound. Defining wound and wound dressing. Wound dressing is a procedure for cleaning and dressing a wound using a sterile technique. Purpose of wound dressing. Wound dressing is necessary because 1. It protects the wound from microbial contamination. 2. It provides or maintains moist wound healing. 3. It immobilizes the wound and facilitates healing. 4. It absorbs drainage from the wound. 5. It prevents hemorrhage. Assessment for wound dressing procedure. Nursing action. Rationale. 1. Note location, size and shape of wound. Indicate types of dressing required and method of securing. 2. Inspect current dressing if present. Indicate type of replacement dressing. 3. Note presence of moisture or drainage on the outside of dressing. Suggest excessive wound exudates requiring more absorbent dressing materials. 4. Inspect wound for volume, color, viscosity, and odor of exudates. Indicate thicker or larger dressing if exudates is copious. 5. Note amounts of freshness of blood on dressing. Large amounts of fresh blood suggest hemorrhage. A pressure dressing may be needed. Nursing plan. Objectives. 1. Client's wound will not be infected throughout hospitalization. 2. Client will verbalize a feeling of comfort and a reduction in pain at the wound site during and after procedure. 3. Clients will be able to move freely and unrestricted by the applied dressing after every dressing change. 4. Client skin integrity will be maintained and improved after 1 week of nursing intervention. Preparation. 1. Explain the procedure to the client and obtain patient's consent. 2. Administer pain relief measures as necessary to ensure client's comfort. 3. Wash hands. 4. Put on clean gloves. 5. Disinfect the trolley. 6. Discard gloves and wash hands. Requirements. Top shelf. 1. 1 kidney dish containing 2 dissecting forceps, non-toothed, and 2 dressing forceps. Include 1 pair of scissors if required. Also add 1 pair of dressing forceps for any extra dressing on the client. 2. 2 gallipots, 1 for cleansing lotion and the other for dressing lotion. 3. Medium-sized bowl with appropriate amount of cotton balls and gauze. 1. Wash hands to prevent the wound from droplet infections. 2. Open covered bowls and receivers to maintain asepsis. 3. Pour cleansing lotion inside the gallipot. Pulling towards the wound decreases the pain of tape remover by not putting pressure on the incision line. 4. Don your face mask. Limit contamination. 5. Don clean gloves. Loosens the bond between dried skin or exudates and the dressing. Stages of wound healing. 1. Primary intention is the ideal method of wound healing. It is a clean straight line with little loss of tissue, well approximated edges, and sutured closed. It is a form of connective tissue repair that involves proliferation of fibroblasts and capillary buds and the subsequent development of collagen to produce a scar. Most surgical incisions and small sutured lacerations heal by primary intention. It heals rapidly with minimum scarring. 2. Secondary intention is healing of an open wound where there has been a significant loss of tissue. The edges may be so far apart that they cannot be put together satisfactorily. Infection may also cause a separation of tissue surfaces and prevent wound approximation. Granulation tissue is allowed to form, followed by a large scar formation. Epithelium ultimately grows over the scar tissue. 3. Tertiary intention is delayed primary closure. The wound is left open for several days and is then sutured closed. There is increased risk of infection and inflammatory reaction. The wound is usually one that is fairly deep and likely to contain accumulating fluid. A drain or pack gauze may be placed into the wound to provide for drainage. Factors that delay wound healing. These are malnutrition, inadequate supply of protein, carbohydrates, fatty acid, and trace elements essential for all phases of wound healing. Reduced blood supply, cardiovascular disorders and ischemia. Medication, non-steroidal anti-inflammatory drugs and corticosteroids. Chemotherapy suppresses the immune system and inflammatory response. Radiotherapy increases production of free radical which damage cells. Psychological stress and lack of sleep. The complications of wound. 1. Wound infection. 2. Dehiscence. 3. Evisceration. Study session summary. In this study session, you have learned about how to dress a wound, why a wound should be dressed, assessment of wound, the technique of wound dressing, the factors that delay wound healing, the stages of wound healing, and the complications of wound. End of study session 8. Thanks for listening.